objections. I'm Beth Guthrie Moss, and Julie Hajewski, Tim Markle, and Ann Harris from the Wisconsin Youth Health Transition Initiative are here with you. If you're on our listserv, you should have received an agenda prior to the call. During the call, please mute your line so that any background noise and conversations will not become part of this archived presentation and be potentially distracting. You can control this in the Zoom conference room using the mute feature located in the lower left corner of the window. We will reserve time at the end of the presentation for questions and comments. Please unmute yourself when you want to talk. We will monitor the chat box throughout the presentation, so if you prefer, please type your questions into the Zoom chat box. The presenters will do their best to address all the questions at the end of the presentation. To help us track attendance, please put your name and organization in the chat box so everyone knows who's here. If you're on the phone, please email your name and organization to guthrie-moss@wisc.edu. That's GUTHRIEMOSS@wisc.edu, and I will put that into the chat box. A recording of this presentation and accompanying materials will be available at a later date on the Health Transition Wisconsin website under the Learning Community tab. At the end of the call today, please complete the evaluation at the link provided in the chat box, and we'll put that in there in just a few minutes. If you must leave the session early, we appreciate your completing the evaluation before logging off. Please provide possible topics for future learning calls so that we can continue to offer interesting topics and quality content to our healthcare transition champions like you. Today, we will hear from the 2 clinics that received small grant funding this year to advance family-centered care coordination for children and youth with special health care needs through a shared plan of care quality improvement project. Our presenters are Megan Teed, DNP, FNP-BC, APNP from the Complex Care Program at Children's Wisconsin, with parent, partner, and advocate, Michele Rosner, and Gemma Warner, MSSW Research Manager, Ted Bach, RN, and Dania Champion, CCA, from the Complex Care Clinic at the American Family Children's Hospital. They will present from their experience building awareness, educating about, and implementing transition quality improvement efforts using evidence-based tools and resources. So let's get started.
Okay, so thank you so much for allowing me to share a little bit about the work that the Complex Care Program in Milwaukee has done, especially over the year, but our journey started 2 years ago. And before I start, I just wanted to thank the nurses that are on this grant with me. Alice and Molly and Lauren truly helped to keep me on task with everything, and again, with addressing, transition with our complex population. So I wanted to start by just giving a little overview of the patients and families that we serve. Our young adults and children are deemed, medically complex and fragile. They have at least 3 organ systems involved and have either 10 clinic visits a year or 5 unplanned hospital days in a year. So they have the complexity and the fragility standpoint. And really the goal of our program is to provide care coordination services to help with the medical management alongside of their specialists, to really offer that support, and at the end of the day, make sure that our patients and families have what they need as they go on this journey of having complex medical needs. So initially when we started transition, I equated it to opening a messy door where things are just falling out at you. You know, that closet that no one's supposed to see, but there's so much in it. So when we initially started our transition work, it was hard to know, where do we start? You know, there's a lot of good pieces, there's a lot of important work that needs to be done, but it was very overwhelming at first to know where we start with our population. And so briefly, 2019, we really started this work. We were lucky enough to get our QI grant and start the work along with it. So the important part for us was, where do you start? And we realized that our organization had a transition policy, had a transition checklist in our electronic medical record, but it wasn't being utilized. And if it was being utilized, it wasn't being utilized consistently. And a lot of people, not only within our complex care program, but within the organization, wasn't aware of it. And so knowing that it was built off of a lot of the great recommendations of God Transition, it was one of those things of not only how do we bring awareness to it, but what aspect of the materials that our organization has do we start with sharing with our, you know, our colleagues, our families. And so one of the things we realized is that transition doesn't stop just because you don't have, you know, the nice packed up, you know, package, the nice gift to give them. And so we realized that really educating our families and providing some of that pre-anticipatory guidance for transition was where we felt that we needed to start. So we created DOT phrases, which is something in our electronic medical record where we type in a certain paragraph information, and anyone who then types in the name of that phrase, the whatever was in that phrase populates. So I have on a future slide of really what that looked like. But we realized that we needed to have our conversations sooner. So we were tending to have them closer to the age of 16, 17, and we realized that that was just way too late. So we started at the age of 12. And so we split it up into different categories. So the ages of 12 to 14, 14 to 16, 16 to 18, and 18 plus. And the initial feedback we got was 12 is way too early to start these conversations. But I think the more we started having these conversations at the age of 12, we realized that our families needed the time to digest even the word transition. So really the age of 12 to 14 was more or less, you're going to be hearing about transition. You're going to be hearing it from your medical providers. You're going to be hearing it from schools, and just start thinking of what that looks like. The age of 14 to 16 was really, you know, the transition coordinator at schools when our patients have their IEP meetings, and starting to have some of those conversations as well with their specialty providers. 16 to 18 was really where we found that the bulk of the conversations and planning needed to happen, especially, you know, a lot of our young adults will require guardianship. So you have the legal ramifications. I mean, everyone does to a degree, but especially with our patient population, many will need guardianship. So when do you start that process? When is it okay for them to go to the Aging and Disability Resource Center? So these DOC phrases were used in our after visit summary. So we would have these conversations in clinic, but then we would also have something that they could take home, they could reflect on, and just start thinking about what was heading down the path. Initially, we were talking about doing one sheet with, you know, the general transition timeline, but we realized that that can be incredibly overwhelming for our families. So we started implementing those DOC phrases last year. This year, we've really, you know, continued to make adjustments to that and providing education in addition to trying to get our subspecialty colleagues on board with having these conversations with us. The other aspect that we had this year, which was great, was a Dreaming Differently presentation with the regional center. We had Build Your Bridge, and we, you know, helped to present that in 2019, but we realized that when it came to our medically complex population, and those who are not going to be their own guardians, we were really missing a lot of important information. And so it was amazing to have that presentation. And I really think that that's going to be a game changer for so many of our families. So some of the things we're currently working on is the transition checklist in EPIC, which goes through, a variety of things that need to happen for transition, not only from the healthcare standpoint, but also some of the legal and social implications. We are looking into making some revisions to really make sure that it's meeting our needs and to also make sure that we're getting the word out that way. So when it came to documentation, and I know that this is a busy slide, but we decided that we needed to really include transition into our graph that's in our progress notes that our families get and their specialties get. So within our shared plan of care, we added that transition column, and this is just a brief example. So their specialists can also see this is where we're going, this is what timeline looks like, especially knowing that different specialties are transitioning at different ages. So what went well? I really feel that our group now has a transition culture. It was one of those things that transition was a topic that no provider wanted to talk about, no family wanted to really hear until it became a crisis. And now, pre-COVID, it was one of those things that we were hearing in the hallway constantly of people talking about what was going well, asking for med-peds providers, and really just sharing information. And I think creating a workflow, a more of a standardized approach, just shows that our families are getting a consistent message, no matter who their provider is, no matter who their nurse is within our group. Areas for improvement, there's many, but our group does a lot of quality improvement work, which is great, but it's also challenging when we're implementing multiple things at the same time. And so looking, month by month with our information, there are some months where everyone's using the doc races consistently and documentation is in that shared plan of care, and other times where we aren't documenting everything we're doing. So that will be, an ongoing, I think, challenge for us, but also an opportunity for us to continue on. Really trying to get buy-in from our other specialists and the organization. We're realizing that not all the players are at the table. Years ago, it seemed like there was more buy-in from different specialties and more people coming together to talk about this work. And now we need to bring everyone really back to the table. And I think the other aspect that we've been discussing is how do we form relationships with our adult providers? We have a couple from different specialties that are willing and have said that they're willing to do joint visits and to have phone conversations and to really help as we pass the baton over to them. But those are few and far between. So we need to continue that work. And I think, there are so many aspects of transition that our group wants to continue to work on. One of the challenges we had this year was really looking for a readiness assessment that met the needs for those who have neurologic disabilities and challenges, and the complex care population, that the readiness assessments out there don't fully meet the needs of our population. And so it's realizing that we're going to have to take, some of the best assessments out there and make revisions to it to really fit our population. Trying to get families engaged with the transition process. We've been lucky enough to have Michele help us with the grant this year. And she's been such an asset and, someone who can really help our families to jump on board with this difficult process. But we're also hoping to get feedback from some of our families and patients who have transitioned. We need to know really what went well, what did not go well, and what do they wish they would have known. So that will be, I think, some of the conversations that we end up having with hopefully, former patients in our program, just so we can really make sure that we're meeting the needs of our patients and their families.
Thanks,
Yep.
Megan. Tim, can you hear me? I'm going to share from our perspective as a family what we learned during the transition process. I have heard, I'm sure my team has heard me say this multiple times. Molly is our nurse case manager in the complex care clinic, but we went into transition planning thinking that our plan for transitioning was to not transition. We wanted to stay at Children's. And we realized that that wasn't possible forever. And so we had some lessons to learn. Can you go to the next slide, Megan? So here's a little bit about my daughter, Julia. She fits all of the criteria that Megan laid out to fit into the complex care program. She has a lot of specialties. She's non-mobile and non-verbal. We went well over our 5-day hospital stay. Julia spent the month of February in the ICU with RSV in February. And then she turned 18 at the end of March. So we had a really a crazy ramp up to that 18th birthday. We actually had our guardianship hearing on February 4th. So just in the midst of Julia's hospital stay, we were working through those transition challenges at the same time. So it was a crazy, crazy lead up to what then turned into the pandemic and the shutdown. So the first lesson we learned is that it makes sense to start with choosing the health system that we wanted to be a part of. And spoiler alert, we are going to Freighter for Julia's care. And that hospital stay in February really played a lot into our decision making. We started with thinking, what hospital, if Julie needs to be hospitalized as an adult, where would we feel that she could get the care that would best meet her needs? So we started with that question. We looked at which health system was most closely tied to children because that's our safety net, and we wanted to have that connection. Obviously, in network for insurance is a major concern. And then which health system does the rest of our family use for health care? Which not all of the answers to these questions were the same health system, but we did choose Freighter, and that's where we're transitioning to. We recognize that we could have chosen specialists from different health systems, but we thought that that would have an impact on continuity of care and care coordination. So we made the decision to go all in with one health system, and so far that's working well for us. The next thing we needed to know is if it was going to be a partial or a complete transition. So would any of her specialists stay at Children's, or were we going to completely transition to the adult world? And I put the picture up here. It's sort of like if you're trying to stay 1 foot in Children's and 1 foot in the adult world. It's like having a foot in 2 different canoes. And it's great when those canoes are lined up, but once they start to separate, things get challenging. So we were focused on maybe not all at once, but eventually we wanted to make a complete transition. We ran into questions like, what age does the transition need to happen? Is it different for different specialists? Were there any specialists that absolutely just did not have the equivalent in the adult world, and we'd be sacrificing care quality if we made that transition? And then we were paying attention to if any of Julia's providers saw patients in both the adult system and the children's system, because we thought they would be a very good bridge for us to kind of help navigate both systems. And we were tempted, I told you our transition plan was to not transition. So it can be tempting to try and keep any pediatric specialists that will keep you, but that partial transition can be tricky, especially during hospitalizations. So we got to the point where we were ready to choose our primary care doctor. And to be completely honest, this was the part of the journey that was a little disheartening for me, or was maybe a little scarier. It was difficult for us to find a med-peds doctor that was accepting new patients that we felt would be comfortable with Julia's care needs. And so that's why I'm so rare and practically mythical is what's up there. But we stuck with it, and we found a primary care doctor that we think is going to be a great leader for Julia's team. She's a med-peds doctor, which was really important to us because she had that pediatric and adult background. We love her personality. We had a list of things that we have learned over the years, doctors that we work well with. And then we paid attention to the size of the practice. She's in practice with 9 other med-peds doctors. So we felt that that was large enough that they would always have a doctor that would be able to meet our needs during off hours, but small enough that eventually our our girl will get to know all of them at least a little bit. So it'll be that comfort factor of knowing the providers. So this is the spot where I tell parents to keep their patients and take heart. This is where the rubber met the road, and we started mapping things out to avoid care gaps. So we created a little spreadsheet very similar to the template that Megan showed, that just had a really quick glance at what are the providers that my daughter is seeing, why does she see them, how often we typically have follow-up appointments. And the key thing that we included is what medications each provider is prescribing. My daughter has a lot of medications, and so that was a really important thing that we knew how that was going to transfer. And then kiddos that are complex like Julia have a lot of paperwork and forms and prior auth, and we just wanted to make sure that anything that was happening on the children's side would also happen in the adult world. We learned that we can't exactly 100% replicate our pediatric team on the adult side. Some of the specialists just have, it's different conditions, have different specialists that take care of them. For example, bone health in the children's world is we're seen by a nephrologist, and in the adult world, it'll be a rheumatologist. So it's a change of specialists, but we just wanted to make sure that each of Julia's care needs were going to be accounted for. And here's just a quick look at what that template looks like and what we kept in it, and a little bit of the information. Julia's got a lot more specialists, so her actual is a lot longer. But this was a nice way to keep us on track, to make sure we sort of knew where we were at with all of the specialists in kind of both sides, children's and adult world. Megan talked about forming those relationships with the adult specialists, and this is an area where we found that was a little bit tricky because those relationships aren't always in place. And so we went to a lot of places to get feedback about adult specialists, other parents that we knew of, friends and family. And to be honest, friends and family weren't of much help. Not many of them have a family member who's as complex as our kiddo. But we worked with our new primary care doctor, and we knew she had relationships for specialists that she'd been working with and that she'd be comfortable working with going forward. And then our pediatric specialists were very helpful. They know us, they know Julia's care needs, and so they were able to point us in the direction of not just a doctor who would be able to provide the care for Julia, but would also be a good fit for the personality of our family. We have been very fortunate in that the pediatric team and the adult side have been working well together. Our complex care team has done a great job of exchanging information with our primary care doctor. And I want to emphasize, they've exchanged information, not just medical records. So there's been that really good information exchange. And then we've been super fortunate for our neurology transition. We actually had an appointment with both the pediatric neurologist and the adult neurologist in the same room at the same time, which was super beneficial. And that kind of warm handoff is carrying over. Ironically, I just got a call from the clinic and the GI nurse on the pediatric side yesterday, and she said, "Hey, Dr. Kovacic is wondering if you've picked your adult specialist yet, because once you have that doctor lined up, she wants to talk to them and have that conversation." So really that information exchange with both the primary care and the specialist has been a godsend in helping us make a smooth transition. One of the things we're finding is that adult healthcare is not always quite set up and ready for these medically complex kids. And so building the right team is going to require some patience and advocacy, but we're making it happen. Telehealth. So I talked about the fact that we're making this transition right in the middle of a pandemic. And so our very first appointment with Julia's new primary care doctor was actually done via phone. And at first I thought, well, maybe we should cancel that appointment because it seems kind of silly to have the first time we meet this new doctor be over the phone. But we went ahead with it, and it turned out to be a really good strategy session. We did a lot of information sharing. We strategized and talked about specialists. We worked through that grid that we showed a few slides ago. And so we learned early on in this transition process that telehealth can be an opportunity. We've learned that we need to be prepared for those appointments. I go into them with a list of questions and a list of goals. And then when we end, we just make sure we're always really clear about who's doing what, and everybody walks away with their homework. So telehealth can be an opportunity. And since that's what we've got right now, for the most part, we're making the best of it. So lesson 7, this is where we've gotten to the point where we inadvertently sort of do have a foot in each of those 2 different canoes. Our transition has been slowed down a little bit, or maybe more than a little bit, by the pandemic. And so we've learned that we really need to be very clear about who's doing what, because no matter how smoothly your transition goes, it is not a single event, it's a process. And so when you're in that in-between zone, it's really important to be clear on who's doing what, like those medication prescriptions. And one thing that we've been very deliberate about is if Julia gets sick during the winter, where do we go to the hospital? Do we go to the adult hospital? Do we go to the children's hospital? And so that was a really important thing that we needed to make sure that everybody was clear and we were all on the same page. And the last thing that I think was a really important thing for us to keep in mind is that change is really hard, and we're all naturally resistant to change. And this change for families is a really high stakes change. There's a lot on the line. And so we have to give ourselves a little bit of grace. We've learned that, or I guess we know that the more that we've navigated with our complex care team on the children's side, the harder it's going to be to let them go. And so we really are trying to find that courage and that patience and that advocacy to continue to make this process smooth. And I put a challenge for our team, and Megan alluded to it when she presented. What can we learn from these families that have gone through it, and how can we make the unfamiliar less unfamiliar going forward? It feels like you're kind of jumping into an unlit room, and how can we turn the light on and make it a little easier for those families to make that transition so it's just not quite so scary and hard. Thanks for letting me share our story.
We're going to hear from Gemma now, I believe.
Unmute myself and share my screen. Yep, hold on. Okay, can you see our slides now?
Yes.
Is that a thumbs up, Beth?
Yes.
Okay, sorry, I didn't hear you. All right, well, now you're gonna hear from the other Wisconsin team. Kristen Sodergren leads this grant at the American Family Children's Hospital. She's unfortunately was called away from the office this week, and so you are left to hear from myself, Ted Bach, one of our nurses, and Dania Champion, one of our care coordination assistants. This grant is in its 2nd year at our site. The first year we spent formulating a workflow for transition for folks in our program, and also developing a shared plan of care for kids 12 years and older. Our activities really mirror very closely what Megan outlined in her talk earlier, as far as reaching out to adult specialists and creating a shared plan of care, and passing that on through the after visit summary. What I'm going to do is just outline some of our major activities for the year. One of the first things that we did was we took our transition readiness tool, which we developed in the 1st year of the grant, and tweaked it a little bit. This is a tool that assesses a family's understanding of the next steps in the pediatric to adult transition process, also their confidence level in taking those steps, and just their overall understanding of the transition process. We have structured this tool as a iPad survey. It has a pre-survey portion and a pre-session portion and a post-session portion. So the way we do this is we hand the iPad to the caregiver or family at the beginning of a routine visit. Our families come in approximately twice a year for just kind of a routine visit. So we hand them the iPad and ask them to complete a few questions at the beginning of the session. And then we complete the visit and hand back the iPad and assess their understanding, confidence, and overall understanding at the end of the session as well. This year, we modified the transition tool a little bit to include an open text box where we ask families to describe any concerns or future questions that they have about transition, so that we can review that prior to the next session and make sure to address those concerns at their next visit. Then the last portion of the survey, they hand the survey back to the provider, and the provider makes some notes into the survey as to their impression of the family's readiness and accepting and listening to the information provided at that session, and also just the content of what was discussed. I think to date we have approximately 34 surveys that have been completed. Unfortunately with COVID, because we administer this survey in an iPad format, we have not done too many of these surveys since March, but we're looking into ways that we could possibly administer this survey, kind of revamp the way we have the pre and post structure, and possibly give it to people in some sort of electronic format prior to a visit. The other thing that we did this year is we have a weekly team meeting, and we added to the agenda for each meeting a check-in about who is coming in the next week for a transition age visit. So all the kids 12 and older are outlined in our agenda, and then this gives us an opportunity to remind the providers to use the transition checklist that is in the electronic medical record, so to make sure to discuss transition related topics. And then it also promotes discussion among providers about specific family needs and concerns with regard to transition. We also this year did a care mapping workshop. This was led by Tim Markle. And we also had, I think, about 8 parents in attendance. It was very well received, and it was an opportunity for us to, so of course it was done remotely, and it was an opportunity for us to kind of test out this format for future possible workshops, which is something that the family said that they really, they would support, that they liked the format, they liked the opportunity to talk among other parents and to talk about issues related to transition. And now I'm going to turn the talk over to Ted.
Thanks, Gemma. My name is Ted. I'm a nurse on the pediatric complex care team at AFCH. And for this slide, I'll be talking about this transition checklist that our team created and put in the patient's chart in the medical record under their problem list. And in the problem list, we created a problem called counseling for transfer from pediatric to adult care provider. So anybody that looks in the problem list can see this checklist that we created. We put it in the problem list for all of our patients starting at age 12 and older. And we modified the checklist this year to include the date of the completion of this age-specific activities, which you can see listed there. So these are, as you can see from the slide, some examples are, early teen years, family has received age developmentally relevant material on transition topics below. Then we're just introducing the transition topic to the family. So start off pretty small and then get into more concrete sort of tasks and goals as we go on as they age. And then we did create an abstract for on the development of this tool, which was accepted by the Pediatric Academic Society's meeting, but unfortunately we were not able to present that this year because of coronavirus and the pandemic. So hoping to be able to delve a little bit more in depth on this topic in the future. Gemma, if you could switch to the next slide, please.
Oh, yeah, hold on.
Sure.
Whoop, sorry.
Okay. Another thing that we did was, so for patients, every patient that is seen gets an after visit summary. But when children hit age 12, the AVS gets pretty severely limited in what information is on it due to, I guess, privacy reasons, things like that. So we created our own special after visit summary dot phrase called AVS Teen that we put in the patient instructions that shows, excuse me, just one second, my child is here. Sorry about that. We have updated this teen after visit summary to include patient facing material. As you can see here, some of these examples are like from the late teens that we put in here, things that we talk about and make sure that the parents are knowledgeable about and that what they present to the child, you know, if the child is developmentally able to understand that sort of stuff. Sorry about that. So when we developed this after visit summary information, we saw it and incorporated feedback from both Tim Markle as well as other parents. And so this example, like I said, shows the 16 and 17-year-old, but the providers may include information from the older or younger age categories depending on the patient's developmental needs and the preparedness for the transition process. Next slide, please. So right now, this is called the Who Am I form that we helped develop in collaboration with adult providers. Kristen Sodergren, the nurse practitioner on our team that has been heading up this project, worked with a group of adult providers that are also working on the transition process on the adult side and helped develop these categories. This is kind of a standard format that we have found in the adult world that we were kind of able to bring over to the pediatric world, to the transition process. So after we developed these categories, we also sought and incorporated feedback from parents as well to make sure that this all is stuff that would work okay. And then we worked with the families to develop this form. Then we gave them hard copies that they can share with their adult providers or post up like in the hospital room on the adult side when they're there. And it also goes in their chart so people can access it wherever. It's helped improve handoff when we team with the hospitalists. So some of these are like, this is Mitchell, a generic made up child named Mitchell. We have his age, what he likes to be called, the people that are important to him, things he's good at. We also have like the legal guardians and stuff listed, what caregivers help him do, what he can do by himself, goals and things he's working on, things that calm him or upset him, routines, and the best way to communicate with him. So that parents and the adult providers have found this to be particularly helpful in the transition process, because it's kind of a snapshot of where the child or young adult is at, and it really gets you to be able to get to know them pretty quickly and easily with all the pertinent information. Okay. And then for one of the cornerstones of our program is working with the children and coming up with goals with the families and the patients that they're working on. We need to update goals at every 6-month care plan update visit. So another project we're working on involves this process, and we developed these goal cards that we can use to help the families and the patients come up with goals that we can work toward. So in response to parent feedback on the goal cards and suggestions, we've identified a subset of 9 transition-related cards in our goal card deck, which you can see some examples of these goals here. And we're currently figuring out the workflow on how to include the use of this subset of these cards with the transition age children. And if you go to the next slide, you can see an example of what these goal cards look like in person. Sorry.
And I'll just add, Ted, that
Yeah.
the goal cards are, they are physical cards if we
Yes.
are having a visit with a family in person, but we also are developing a website that lists that has the goal cards there, and people can review them prior to their visit.
Yes.
And I've included on this slide, I think you're going to get the slide deck after this presentation, but I've included a link where you can review all of the goal cards. I think, how many are there? Like 39 in total?
Yeah, there's quite a bit.
Yeah.
And they've been very helpful. The parents find them to be very helpful. And we developed, these were developed by Becky Burns, who is with the Children and Youth with Special Healthcare Needs statewide coordinator. I believe she's on this call as well. Hi, Becky. And yeah, we found these cards to be super helpful. And like I said, we're working on incorporating the subset of the more teen and adult sort of transition goals into our transition discussions with the families.
Do you want to go ahead, Dania?
Sure. Hi, everyone. My name is Dania. I'm a care coordination assistant with complex care at AFCH. And I was very excited to continue working with the team to continue efforts on the grant this year. And one particularly enjoyable aspect for me was partnering with parents and conducting interviews with them. And our team conducted 5 phone interviews with caregivers who have children at various stages in the transition process. And I led the interviews and asked questions while another team member took notes to summarize. And we compensated participants for their time by offering gift cards at the end. They could choose from either Target or Amazon. And the interviews offered a lot of valuable information and insight into how families experience the process of transitioning to adult care. In addition to noting the age of the patients, their enrollment status in our program, and what stage of the transition they're at, we also asked the questions you see here. The questions that were asked were, what part of the transition process has been completed? Were you satisfied with the transition process, and what could have gone better? Were there any obstacles? And if so, how did you overcome them? And what advice would you offer other providers, advocates, caregivers, et cetera, beginning the journey? If you could go to the next slide, please. Thank you. And the children that we had for the interviews, one was 14 years old, currently enrolled in the program at the beginning phase of the transition process. Then we had 2 15-year-olds that are enrolled in the program, and they're at the middle of transitioning. We had a 17-year-old that was right about to transition, and a 19-year-old that had already graduated from the program. So it was the post-transition phase. Next slide, please. These interviews led to an abundance of valuable information, and we found that some common themes stood out. Families expressed gratitude for the services that the complex care team offers. They felt supported by the team, and they were satisfied with the discussions and information received so far. A lot of them expressed they did have trepidation at the beginning when talking about transitioning to the adult world, and they also said that they felt a sense of community and validation in knowing that they were supported along the process, both by the team and also in relation to other families going through the process. Next slide, please. Parents also offered some great insights. Here are some quotes that we took from the interviews. Some of them were, the PCCP team did a great job discussing the transition process, and they help you along the way. It's nice that they introduced it so early so we have time to talk about it. It doesn't feel like you will be pulling the carpet out from underneath us. The team is comforting and familiar, and it is intimidating for parents to make the leap from peds to adult since they are supported so well by the complex care program. The adult side just does things so differently. You're scattered at different UW facilities. The adult side should be prepared to catch the ball. Next slide, please. We then looked at all the interviews and kind of compiled some common suggestions that families offered. And they offered some very great suggestions for future work for the team. One of those was to have more candid discussions. Like I said previously, families expressed trepidation during the early stages of transition, but they also acknowledged the need for those early conversations to take place so they could begin processing the information and preparing for the future. So some of them even expressed that, addressing those fears head on early on helped to overcome their hesitancy and help them through the process. And they also said that an honest acknowledgement up front that the adult world is different, but it is also still manageable. That was also helpful. They offered the idea of creating a youth to adult folder for families at the end of the transition process so they could have, some handouts in their hands. Like Ted said earlier, we do some of that and we print it out on the after visit summary, but some families said that it would be really nice to have a folder with those handouts so they could have paper copies. They were saying that some of the handouts that we could include could be transition steps, legal steps needed toward the end of the transition process, and include other family experiences. So some families had this great idea to create a handout or several handouts with information from other families that highlight their experiences, such as quotes, frequently asked questions, advice, what to expect, things like that from families that have actually gone through the process and experienced it. They also said it would be really helpful to highlight the positives of the adult world, so that they understand what they can look forward to as they transition. So some families said there might be a possibility of additional respite time that could be approved. Referrals can be placed to the Aging and Disability Resource Center, and they can arrange home visits to assess needs and inform patients of all the resources that they have as an adult. They also said that some insurance companies and primary care offices have RN care coordinators that can assist and take on some of the role that the complex care team did play during their time as in the pediatric world. So they said that that would be helpful too if there was a handoff to somebody like that. And then they said continued collaborative work on smoothing that pediatric to adult provider world. So that handoff, such as closing loops, warm handoffs, conveying the patient's story more readily. They stated that the systems in the adult world seem to be a bit more built around how the providers work versus what the families need or how the families work. So any way to improve that and make that more patient facing would be helpful. And a lot of them were very hopeful that someday in the adult world, there would be a similar program like complex care to catch them on the other side. So they offered a lot of wonderful information. It was really great to talk to families and parents and receive their feedback. And we just got a wealth of information from them. So with that, I will turn the presentation back to Gemma.
Sure. So we are approaching, I don't know, like the last 6 weeks of our grant, and we have a couple more remaining activities for 2020 that I'll outline. In addition to incorporating that parent feedback from the interviews that Dania was talking about, we will be doing an electronic medical record audit of our transition activities. We're going to be looking at 2 metrics. First, how many folks have a transition checklist in their medical record, which we think is 100%. And then the second metric we're going to look at is how many folks have a transition-related goal in their shared plan of care document. So that's what we have left to finish up for this year. And that concludes our summary of our 2020 activities for this grant. I think we're going to open it up to questions for both teams, right, Beth?
That is correct. Thank you. Yeah, and if anyone would prefer to put their question into the chat box, then I can relay that to the presenters. So we have just about 6 minutes for questions.
This is Ann Harris. I'm just trying to put a sort of a proportion in my mind. How many of the I guess they're individuals, but patients in each of the complex care teams are transition age. So I know that you do more than, you serve a wider age range, but is this like 10% of your clinic and or more? Or I'm kind of curious as to, when you said 100%, I'm like, wow, that's impressive. But also, it's just like, how many kids are we talking about? I'm just curious.
Oh, so for AFCH, I think there are we have 250 kids in the program, and I think 80 or 90 of them are 12 years and older.
Wow. Okay. That's higher than I thought it might be. So thank you, Megan.
And in Milwaukee, so we have about between 120 and 130 of our total group. We're now up to 705 patients. So we're looking at about like 15%.
Yeah. Okay. Great. Thank you. And obviously, this is a revolving. People age out, and how late then are you able to? As we're talking about transition, is there sort of an 18? Is that your cutoff, or can you see them past 18 for any length of time?
So our group can, we don't have an age cutout. Really what we say is we'll continue to follow them until at least the majority of their specialists have transitioned, unless families feel that, they're good to go. And then by all means, we won't necessarily keep them until the transition is final if they feel that they have, their medical home and the support that they need. What I will say is when I looked at the data, because I think our hospital system thought that we had, some of the late 20s, early 30-year-olds that just haven't transitioned yet. And the last time I looked at our data, I think the oldest adult in our program is about the age of 24. But a lot of our young adults we're finding now, especially after some of the implementation, are transitioning around, I would say, 19 to 22.
That's the same experience in Madison.
Okay.
We're technically allowed to keep the kids in the program until age 26, I think, but most everyone is done, I think, around age 20. Would you say that, Ted? Yeah.
Yep. You're
This
muted.
is Sharon.
Yeah, sorry. We have a couple outliers that are a bit older into their early 20s, but yeah, I would think for sure it's usually like 18, 19, 20 that they are transitioned.
Great. Thank you so much.
All right. Any other questions? I did want to say that the comments in the chat box have been very enthusiastic, and the presentations were fantastic. I have a question. I was wondering if the materials that you developed during this period could be available to older people who didn't have the opportunity to transition. To people maybe in their late 20s. This is kind of a personal question for me, actually.
So are you referring to the links that we provide in the after visit summary and
the who am I,
sure.
the chart, those kinds of things. Yeah, that would just be, I don't know. I guess they would probably help anybody who even had started to see an adult provider, maybe try to develop a relationship that doesn't exist yet.
Sure, we can share all of that information with you, Beth, if you want to distribute it to the group with the slides afterwards.
That'd be great.
This
Yeah,
is Sharon.
I'll do the same as well, Beth.
Okay, thank you.
Would it be possible potentially to post it on the Wisconsin Youth Health Transition website? potentially? Because I just really think, I think this presentation just, I put it in the chat, but was outstanding. And so I think there were good tools. I loved hearing Michelle's perspective, the survey results. I think all of this would be really informing. And I think we have colleagues from other states who are also joined us. So I think both our colleagues in Wisconsin, but also others would be really interested in the materials you guys have put together. And to say thank you for really an outstanding presentation.
Thanks, Sharon.
Yeah, this is Meg Steinley at the Southeast Regional Center at Children's Wisconsin. And I think whatever tools are developed and can be shared, I think is going to be just that much more helpful for families, you know, because something's going to strike one person one way and another thing is going to strike somebody a different way. And they're going to go, oh, I really like that better than this. So to give families options. And we're in the process of vamping our Children's Wisconsin Transition to Adulthood webpage. And it's looking pretty awesome. I have a draft that I need to go through. But we're hopeful to be able to provide as many resources there as possible. And I love the Powtoons that American Family did. I thought that was a pretty cool tool. So.
And I did want to say that the Powtoons was shown on a previous learning community call, so our session, so I can definitely refer to that in the follow-up email to everybody. Yeah, I mean, we're getting lots of feedback about how everyone would love to see this on the website, and I definitely think that it could go up on the Health Transition website if that's okay with those of you who created the materials.
Sure.
Okay, great. All right. Well, it is 1 o'clock. I could probably listen to you all for another hour and just really, really appreciate everything that you shared with us. Thank you, Megan, Michele, Gemma, Ted, and Dania. The information that you provided is very important for health professionals to be able to explore and implement those best practices in transition. Our evaluation link is in the chat box. Would really appreciate if everyone could fill that out for us. And we hope that you'll join us in 2021 when we're planning our next series of quarterly learning community sessions. Dates, topics, speakers, and other details will be posted on the learning community page of the Youth Health Transition website and sent to the listserv. Thank you for your participation. This concludes our presentation.
Thank you, Beth. Bye-bye.
Thanks. Bye.
And have a good day.